Antibody cocktails for treating the coronavirus. Most of this information is coming from an article. Scientists are working on antibody cocktails to treat the coronavirus. Antibody cocktails is one of the latest experimental therapies. It's thought to provide temporary immunity for at least a couple of months and treat those who are infected and experiencing symptoms, basically giving them time to develop their own inherent, more long-lasting antibodies. Antibody cocktails have been around since the 1980s. They've been made for viruses like HIV and Ebola, certain cancers, lupus, and multiple sclerosis. The pharmaceutical company Regeneron is currently leading the fight against SARS-CoV-2. It expects to have an antibody cocktail widely available sometime after June. And we've got a video where there's an interview of the CEO for Regeneron talking about this. New York's Mount Sinai Health System also has teamed up with the drug maker Sorrento, create a cocktail that could protect someone for up to 2 months. Now, antibody cocktails are not the same as plasma transfusions. You know, plasma transfusions started, over 100 years ago, back with transfusion of plasma for people with strep, infections due to streptococcus. Researchers first identified the antibodies in people's plasma that works best against a specific virus. And we'll talk about that in just a second. There's a lot of antibodies, but you got to find the ones that work. Then they synthetically produce copies of them in a lab. Now, synthetic is also a little bit of a misnomer because, again, as I said, it's a biological product. When you're using convalescent plasma, you're basically giving all the antibodies that someone has. But when you're using an antibody cocktail, you're basically using 2 or 3 specific antibodies that are very specific for this virus. So it's a much more targeted therapy, said Dr. David Rosenthal, the medical director at Northwell Health's Center for Young Adult, Adolescent, and Pediatric HIV. This can be helpful if a virus were to mutate. If the mutation renders one antibody useless, there will still be at least another antibody that can bind to another part of the virus. Even if a vaccine were to become available soon, not everyone will respond well to every vaccine. Antibody cocktails should give those people another option. Now, here's some challenges. The preliminary data shows antibody cocktails work well in some cases. Other antibody cocktails haven't worked well at all. For example, the one with HIV. We'll talk about that in a minute. Antibody cocktails can still be challenging to make for viruses that mutate. Every virus mutates sooner or later, but the question is at what rate and how significant is the mutation? Despite our coverage of that Los Alamos mutation, I'm not seeing a huge amount of evidence. For example, it's nowhere near the programmed mutation rate that you see with seasonal influenza. For example, scientists have struggled to design a reliable antibody cocktail for HIV. And again, it has not worked. HIV has some significant inherent issues that make it much more difficult for treatment and vaccine and antibody cocktails. With SARS-CoV-2 behavior not yet fully known, there's no guarantee a cocktail will work. Also, like any treatment, there's always going to be risks, benefits, and alternatives. Antibodies can also backfire and make it easier for a virus to enter and infect cells. Researchers need to identify the types of antibodies that are neutralizing, and remember, not all of them do that, which part of the coronavirus they bind to, so that they can make a well-rounded cocktail. They also need to figure out how long the antibody cocktails can provide immunity for and how that varies from person to person. That requires clinical trials. The exciting thing about using antibody cocktails is that they provide the potential to very specifically prevent transmission of COVID and possibly help people that are already infected, said Rosenthal. But they're very early on in design, and we have a lot of work to do to understand if they really can make a clinical impact. So I'd like to talk with you a minute about the webinar. People don't understand what the webinar is. It's actually a great way to get some access to healthcare that you're just not going to get any other way. You actually get the lab tests yourself at a local lab, a Quest lab near you, for the inflammation panel and the OGTT and the insulin survey. These are things, inflammation and prediabetes, that your doctor just does not know about. And here's the thing. Harvard Health and many others have said, look, sudden death is not always so sudden. The Hollywood picture that it's a bolt out of the blue is not realistic. It's more like real lightning, preceded by clouds, wind, and rain. Stop that metabolic storm before the lightning strikes. And here's where that metabolic storm comes from. It's inflammation, and it has to do usually with prediabetes. So again, we actually get labs, we go over them in the webinar, and then you can start finding out how you can prevent that heart attack others said that you couldn't even predict. We can show you how. Thanks.